Good evening. I'm Sahar Zaman and you are with the Urban Debate. Thanks for being with us this evening. You're watching the show which has just won a hugely commendable award at the ENBA 2020, the best current affairs program in English for this year. And for that, we thank all our viewers, all our participants who continue to remain with us every night, 8 p.m. onwards. And we continue to discuss issues here that are of prime concern to our viewers, to the people. And today, the prime concern that continues to remain is the COVID surge, as the numbers that continue to rise. Before we take up further issues on why this is the second wave could be seen differently to help us understand why this surge is happening, let's get you the figures first. The figures reported of the past 24 hours. Yet again, another spike. 89,129 fresh cases and 714 deaths of the past one day. What we're asking tonight is, are learnings of the past 1 year of the pandemic enough to fight this second wave? Is the second wave different from what we've already experienced in the past 1 year? Does this mean that we have to relook on our ongoing vaccination drive? Lockdowns are no longer the solution. What more could work? And more importantly, to study mutants that have been revealed in genome sequencing on how they're behaving differently. What more could be required here in the system to fight the second wave, which seems to be spreading faster with a far more faster infectious rate than what we've seen last year? Let's in fact throw this open to our experts, to our panelists here with us tonight. We have Dr. Lakshman Jesani, who is the consultant, infectious diseases, Apollo Hospitals. Ms. Shweta Shalini, spokesperson of the BJP, here with us, and also Dr. Sameer Dalwal, who is the spokesperson of the NCP as well as developmental pediatrician with us. But first, we're going across to the expert voice. We have Dr. Lakshman Jesani here. Dr. Lakshman, in your view, in what we have been observing so far, at least in the past 30 days, on how these cases have suddenly surged, from your understanding, is the second wave going to be drastically different from what we've seen last year?
I don't think so, because I believe that the second wave would be even bigger than the last year, but would not be that severe. The reason being because people are getting vaccinated. At the same time, the government is also taking all the measures to control the infection. And looking from purely from a medical point of view, the type of cases that we are seeing in the second wave, there are certain distinct points that we notice, like younger people are getting admitted, younger people are getting infection, not so much of the old people. The infection is being picked up early, maybe because people are becoming more aware. So people are coming to us earlier, maybe in day second or day third day, they are coming and they are turning to be positive. Because they are coming to the hospital, they are getting admitted earlier. So we are intervening earlier. And that is the reason why probably the mortality rate is not that high. However, for the past few days, the mortality rate has increased. But if you look at the entire mortality for the last 1 month, the mortality rate is not that high as it used to be for the last year. So these are certain changes what we are seeing in the second wave. Younger patients, earlier presentation. Some are even having non-respiratory complaints. We are having patients who are coming just with tiredness, weakness, loose motions, and they are turning to be COVID positive. So there are different presentation which is seeing, and the reason I feel is probably because COVID is not just an infection disease. COVID is more to do with your immunological response as well. So maybe now, because of the vaccination and because of the awareness which people are having, the COVID virus is also slightly behaving differently. Now, it is behaving differently, whether there is a mutation in the virus, that is the reason why it is behaving slightly differently, or whether the virus has adapted to this new immune system, and that is why it is behaving differently. These questions remain unanswered.
That's right. And in fact, that's what we're still trying to find out on how this is behaving differently, which could add into a larger understanding to help tackle this second wave better. Dr. Dalwai, in your view, what are those points that governments, including central government, now need to relook at? If COVID-appropriate behavior, even if followed, isn't helping in the long run here, should there be a relook into the vaccination drive? Should there be a relook into how the virus is behaving in 2021?
Say three things that the government needs to do on a priority, and that is vaccination, vaccination, and vaccination. I think the time for lockdowns is gone, because the reason for the lockdown was basically to allow the governments across the world to prepare for the onslaught, and that was achieved last year. as Dr. Jasani just mentioned, if you look at the death ratio, or even if you look at the rate of complications, we are avoiding that because people, especially in Mumbai and Maharashtra, I can tell you, are going ahead, getting tested voluntarily, getting admitted if needed, getting their investigations done, and are quite open about getting medicated if needed. And that is preventing, like he rightly said, approaching the medical professionals earlier as compared to wave one. So that is helping the mortality or the morbidity go down. But yes, the numbers are increasing. I think the game changer here is to do something where we will have lakhs and lakhs of people being vaccinated. It's very clear we need about 600 million doses in all. So what we need to do is have those doses. But what we've proposed again to the national government is central government, allow pediatricians to vaccinate. The advantage being pediatricians already have a cold chain in their premises. They are used to vaccinating. The community is used to going to the pediatrician to get their child vaccinated. We have about 30,000 members in the Indian Academy of Pediatrics. We have written to the government about a month back. This issue was raised in Parliament by Ms. Supriya Suliji. We have already requested Harshvardhan ji to consider this request of ours, because in one sweep move, even if we have about 1,000 doses given per pediatrician, we have 30,000 pediatricians across the country. So you calculate the numbers that can be rapidly scaled up. And I think we need a game changer like that.
All right, so let's have Shweta Shalini, spokesperson of the BJP here, respond to that here. Shweta, of course, we're aware that the government has opened up the vaccination drive from 45 years upwards to all people across the board, irrespective whether or not you have a comorbidity situation here. But do you think there is more to add? And what Dr. Dalwai just mentioned here, to make sure to also reach this target point that the central government has already issued to the states to ramp up vaccination, to perhaps be taking a re-look at it on who can be made to vaccinate a larger population. And also another request that the Maharashtra government, the worst affected state Maharashtra had, was with the central government having refused to not allow door-to-door vaccination, at least for senior citizens.
Yes. So first and foremost, I think I'm very, very thankful to Samir ji to start off at least by non-politicizing this topic. And I would want to continue the same. I would not want to politicize this topic. But yes, he primarily said
absolutely,
that the
so would we.
three basic thing was vaccination. But I would still feel that it is testing, it is contact tracing and vaccination. So these three things have to go hand in hand. What I feel specifically in the case of Maharashtra, what we've seen is containment strategies have not really worked. BMC had a very, very laxative view on containment strategies. 170% rise in containment areas happened without BMC actually realizing that they need to really do something about it. I think especially with Maharashtra, the government has been caught napping, because contact tracing, if you actually see the case versus contact ratio, it has been 1:20. Now, unfortunately, even the testing has been very, very poor. Yes, the government has now increased the testing, but it is still not at par. And that's why we see atrocious numbers in Maharashtra.
But Shweta, as compared to other affected states here, Maharashtra is still on the higher numbers with respect to contact tracing as well as testing. So don't politicize, as you yourself said at the start of your statement, you would not do. There have been other states here which are looking at higher numbers, but they have fared very poorly in terms of contact tracing and daily testing. Maharashtra has the highest figures on that.
Yes, if you would have allowed me to complete, I was basically trying to say that unfortunately it is a death rate which is the highest and the most prominent figure that we need to worry about, because in the last 24 hours we've seen about 200 deaths in Maharashtra. So let's understand, and without politicizing this, yes, vaccination is very, very important, but even inoculation drive, if you actually see, has been just about 60%. The central government has sent in vaccination. It has been made amply clear that the implementation of the inoculation drive is something which is the prerogative of the local government. Yes, there have been certain caps on how to implement, but especially for BMC, especially for Mumbai, considering the density of population in Mumbai, it was made open to the private players. But still, we have not been able to contain the spread. Neither have been able to contain the new trends or the new viruses, the mutated viruses that we see in Mumbai and Maharashtra today. So unfortunately, I still
but
feel
Shweta, we
that
have to look
apart
beyond
from vaccination,
Maharashtra to other states here as well, because you attack Maharashtra and you
yes,
look at this politically. There are, of course, Maharashtra numbers are the largest, is the biggest chunk here of the country, but other states here are also looking at the rise. There are other states here on the list which are seeing a sudden surge, and it's not just for Maharashtra. There have been suggestions coming in from other states here as well to universalize the drive in terms of opening it up to a far bigger population here, not just 45 and above, and especially when we're looking at the second wave attacking, with the virus attacking youngsters more. It's already been established that in the second wave, it is not just attacking youngsters in terms of people, children who are of the age of up to 10 years. They, of course, still do not have a virus for that age bracket, but it is attacking adults 18, 20 years up onwards, which wasn't the case in the first phase. So, which is why I'm asking how the vaccination drive can here be changed, and perhaps does need to change here, because we're racing against time here in this second wave. Dr. Jasani, would you like to add to that?
Yeah, I completely agree with you. We are seeing younger patients getting infected. So I agree with Dr. Sameer, what he has suggested, that improve the vaccination coverage. So I suggest that any patient who is above the years of 18 years of age, he should be getting vaccination. And the vaccination, the coverage should increase in terms of numbers. And it's a very good suggestion by Dr. Sameer that even the pediatrician should be allowed to vaccinate. In that case, what will happen, the vaccination coverage will increase and there will be more and more people who will get vaccinated. And with regards to the death rate, I just need to add that we have to see the death rate with respect to the number of cases. So if you look in the last 1 month or so, the death rate was not that high. But in the last 1 week or so, there has been a surge in the number of cases. So correspondingly, there has been a surge in the number of deaths as well. So even though the death rates have increased, I'm still not that worried, because the case fatality ratio is still not that high as compared to the Western countries. So yes, we definitely need to be more vigilant. We need to follow the infection control measures. And of course, we should need to increase our vaccination coverage.
Right. Dr. Dalwai, what is it that we need to focus in on more? Is it an aspect of reinfection in cases, which is something that still hasn't been addressed? We don't have the figures to that here. And also with respect to how the mutants are behaving differently. Is it clear by mere observation, which still hasn't been established on record though, that the mutants are more infectious?
So, Sergi, the study done by ICMR, I believe out of 1,300 people who are supposed to be reinfected, only 54 or 55, I forget the exact number, actually had true reinfection. So, we are not very worried about reinfection on a public health point of view at this point of time. I would also not like to politicize the issue as my friend has done here, because I am also a doctor and I have to stick to my discipline more than politics. The issue here is this, as Dr. Jasani mentioned, today, the younger generation, as we mentioned, 31 to 40, is getting more infected. Why do you think that happened? Because that is the generation which is out on the road, out in the open all the time. And that is where they've got the infection from. They're bringing it home. And a 31 to 40-year-old group has an older generation at home and a younger generation at home. And that's exactly what's happening in the high rises. The other point that Dr. Jasani mentioned was that the death rate is not high. A 200 number or a 400 number is nothing compared to a population of 18 million in one city. So what we are talking about is percentages in terms of public health. It's not absolute numbers only. The issue here is we need to worry about the total numbers. Then you need to vaccinate, because it's a virus. It's a new virus. There are only two things that can happen. Either you get infected by the virus and produce an immunity, or you get inoculated and vaccinated and don't get the virus. So it's very simple. If we increase the number of people who get vaccinated, the overall number of people who will get the infection in the first wave, second wave, third wave, fourth wave, whatever you want, will be lesser. But if you leave the population unvaccinated, then the numbers would be higher. Finally, why is the vaccination drive not more? It's not shown anywhere by any study that the vaccination number or proportion is lesser in Maharashtra compared to other states. And hence, finally, I would like to make a political point. Wave 1, Maharashtra, Kerala. And then the whole country sees the same thing and goes into lockdown nationally. wave to Maharashtra, 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 Maharashtra.
Right.
And now the whole country is getting the same thing. At least people who stay in Maharashtra should think twice before embarrassing and shaming the own state where they stay in for political purposes. That's all I would like to say politically.
Shweta, would you like to respond to that? Because case rises are being seen in the states of Karnataka, Madhya Pradesh, Haryana, Gujarat, across the board. They're of course far less than Maharashtra, but they are increasing, which is why we're looking at even BJP state governments taking more stricter measures here. Karnataka, for instance, has gone back to a lot of the lockdown measures that were seen last year.
So you said it yourself. I will make the political point first and then the non-political point, just to answer Sameerji's question. I think let's understand this. Why is it that Maharashtra is saying, and why is it that it's fourth largest in the world? It's a state, yet it is the numbers are fourth in the world.
It's larger than most countries in the world, by the way.
Yes, so that's fine. That doesn't give it a place in being the fourth largest numbers in COVID in the world. So please understand, Sameerji, one of the biggest challenges has been that the time that stricter rules were being applied in Delhi, that time Mumbai was just caught napping. Your government was actually sleeping. And that's the reason why there were no fines. People were not wearing masks. You said it yourself. It is these people who moved out on the road and hence got the virus back. So please... So yes, they are having...
No, but Shweta, people have not been wearing masks anywhere in the country. It's not that you can point out a person without a mask has to be a Maharashtrian or someone living in Maharashtra. Shweta, COVID-appropriate behavior is not being followed anywhere across the country.
So
be it Maharashtra or outside.
Numbers rising. That's why we are seeing numbers rising across the country. But let me take an example of another non-BJP state like Delhi. And Delhi has been very particular with fines on masks. And that's the reason why you do not see the rise in numbers as high in Delhi as in Maharashtra, including Mumbai. No, yes, you're right. And we don't want to politicize it. That's the first thing I said. But you need to understand that after all, the government needs to be responsible.
Delhi, of course, also, let's just remember, is a fraction of the size of Maharashtra here. And Delhi also, sadly, is seeing a surge right now. Dr. Jesani, I haven't got a valid answer here from him as far as specifically in relooking the vaccination drive instead of blaming the people of Maharashtra. One doesn't want to do that. It's actually the truth that no one across the country, sadly, is following COVID-appropriate behavior. And there has to be some other reason on why the numbers only in Maharashtra are rising so drastically as compared to other states. Even the other states on that list of 11 states that the central government has pointed out, saying that these are the 11 states of grave concern. We don't see COVID-appropriate behavior there either. So Dr. Jesani, do you think that the government's argument of not following COVID-appropriate behavior only in these states here can be the cause? Does that still find resonance? Because there are cases that are rising outside states of Maharashtra here as well. There have been violations outside states of Maharashtra here as well. And can this one stop-alone lesson of COVID-appropriate behavior be the only solution even today when we're sitting on the second wave?
Yeah, so we have to look into what could be the causes why there is a sudden rise in all these number of cases. So there are 4 things which I like to mention. The number one is, are we dealing with a mutant virus? Because there are some case reports in which there's possibility of a double mutant Indian strain.
Absolutely.
So are we seeing a mutated virus which is there, especially in Maharashtra where the new cases are increasing? Is that one of the reasons? We need to find out. Second thing, there is a bit of a fatigue which has been developed amongst the people with respect to wearing the mask and following infection control measures. See, for the last 1 year, people have been trying to follow the infection control preventive measures.
But Dr. Jesani, very quickly, please, sorry for the interruption here, but I just want to hold on to that point of what you said here. Are we seeing a strain? Yes, there is a strain. Even the government says that there is a twin mutant virus here locally in certain districts in Maharashtra that has been reported. There is no denial of a mutant virus, but there is no follow-up to that, whether or not this is the mutant virus, which is far more infectious. There is denial on that front. Do we need to study that aspect further?
Absolutely. So we need to do the genetic study of the virus, maybe by the National Institute of Virology in Pune, and we need to see whether these viruses are now becoming easier to infect others. So if this is a mutation which is causing rapid infection, so means a person would not catch the first wave of infection, but he will very rapidly catch the second wave of infection because the virus is mutated to become more and more contagious, more and more effective. But luckily for us, this virus has not become that virulent. When I say virulent, it means basically the virus can cause death in a patient very rapidly or very rapid illness. So even in the second wave, even though more number of people are getting infected, the virus is not that virulent, and we are not seeing so many people having more morbidity and more mortality. So that I think is good for us. Maybe there is a drop in the guard by our place, our side, that we are no longer following the infection control measures properly, because the awareness is there. I think given for the last 1 year, people are aware about the deadly nature of the virus, but maybe it is the fatigue which has been set in, and maybe people are no longer bothered about it, or maybe even vaccination is causing a false sense of hope that, if we get vaccinated, we can just not follow infection control measures. So I think it is
Okay.
multifactorial reasons due to which the cases are rising. It cannot be pinpointed to any one particular aspect.
All right. So absolutely. So let's look at these multi-factors here and work along with giving these suggestions to the government instead of one standalone point of COVID appropriate behavior. Of course, it's important here, but there has to be a relook on the vaccination drive as per what experts have stated to us. There has to be a relook on how the mutant viruses are behaving. Apart from just establishing the existence of mutant viruses, are they the cause of this spread? Are they the cause of why the second wave is perhaps behaving differently? The second wave is attacking different age groups now as well. There are so many more layers to why the second wave is being hit in the country in this manner. It's faster and it's behaving differently here as well in terms of age groups. It's being seen in newer clusters, school clusters, high-rise clusters, and newer districts in rural areas here as well. We appreciate all the panelists who've been with us. Many thanks.